Today I want to talk to you guys about the different apps that I use for my third and fourth year to just kind of help me during my clinical rotations. Hopefully this will be very informative and encouraging to you guys. So let's do it. I'll start out with online Mitad. As you guys probably know and have heard of, online Mitad is a resource that there's internal medicine doctor who teaches students and give lectures. It was super helpful, very concrete about all the things that you need to know for your shelves exams and for your step 2 CK, right? So online Mitad was super amazing. It's nice that they're free. If you go online and just sign up, you get all the free lectures, but you can also sign up for to get more like premium things like questions and some other interactive things like flashcards, or even this app. It's really for people who are premium members. So if you can afford it and you get the premium, this is the app for you. I don't remember getting the premium membership because for me I used the videos and then I would use Anki. But this app I would say could be very amazing and useful for those who are premium members. But if you can't, you can just go online and do it. So one advantage of getting this is that when you're driving, for example, to the rotation, or you're coming home, or sometimes when you're just on those places where you can easily waste your time, I used to actually listen to the lectures and sometimes even just repeat them or something like that, and it was just a good way to passively keep on learning. So this could be really useful that way. Another app that I found useful, again, Youold, should always be in there. When you're in your rotation, sometimes you just have downtime. You're waiting you're attending to round, you're just sitting in the trauma bay, just waiting for something. It's always nice to have your Youold out there open, and you can just kind of do your questions as you're waiting for something to come on. So Youold again is super important. For me, I used another QBank as the third year. It was Amboss. They also have their QBank there. You can see all your sessions. You can kind of go back and review your questions. You can create your own session and stuff like that. You can create your own session, and so that was super useful. I would recommend it. And then the next app that I used, of course, was Anki. Anki's, everybody knows about Anki. Anki just has all this flashcard and decks. So I'll just show you guys my third year deck here. Let me open it. Yep, right there. So I divided mine by clerkships. And so when I was in family medicine, I would go through the family medicine, internal medicine, OB, and all that kind of stuff. And as I did my questions on Youold, I would actually end up making my own decks. So when I missed the questions, and so that's how I kind of reviewed stuff. And again, Anki kind of allows you to, say, hey, I want to see this again, or I'm good, or that's easy, stuff like that. So Anki's should be your friend if you like flashcards, if that's kind of how you learned, and it just helps you retain the information even better. So I would encourage Anki for sure. Sorry, so one of my lights just turned off. But another app that I wanted to talk to you guys about is the Flashback app, which is again by online Mitad. This is something you get when you have the premium again, which I didn't have. So but that could potentially be very useful as well. And as far as when you're on your rotation and not just for your shelves and step 2 CK, I would recommend these two apps right here, right? So Uptodate and Epocrates. So I would start with Uptodate. Uptodate, I'm sure most of you know it, but maybe if you're a second year, first year, you might not know it, know Uptodate. But Uptodate is so useful because it gives you all the current like things about whatever condition you want, about how to treat things. It's pretty much a program where these doctors and then scientists came together and look at the most recent papers and pretty much combine all that evidence and put it in very good summary almost, right? So I would recommend Uptodate. Usually your school would give you access. So for me right now, I'm not getting access because I'm in 4th year. I haven't been to school in a while. And so they want me to log in with my school or something. But anyways, so I would get that though. You would have it on your phone, and whenever you're in rounds or you want to look up something, that would be a very good place to look at things. And then Hippocrates, this was more for, I used this one for like drugs. So like let's say you are in internal medicine and you are trying to look for these hypertension medications or something like that. You can kind of look that up and you can look at the dosing, which is pretty useful, right? And then you can look at all these black box warning, and you can look at adverse reactions. Again, all these things are good. So not only are you getting better clinically, but you're reviewing for your shelves and for your CK. Those are the really apps that I would recommend for you guys. That's all I got. If you guys have any other comments or suggestions on what apps you guys are using, please leave them in my comment section. Would love to hear it. And as usual, just stay motivated as you're grinding, and you're destined to do great things. You're here for a reason. So I want to wish the best for you guys, and until the next one, I just want you to remember that this journey is not just about you, but it's more than you. There's so many things on the line. There's so many people who need you to go where you're going. There's a lot of patients who will be saved because of what you're doing. So just always be ready and have that mindset of put me in, coach. See you guys.